Having pain on your shoulder? People think that as long as you've got pain on your shoulder, you are experiencing frozen shoulder. But that's not always true. The most common cause of shoulder pain is actually shoulder impingement, whereby you actually have got a tendon in the shoulder that's being pinched between your humeral head and your subacromial space, causing an inflammation onto the tendon and giving you pain. So it's not necessarily that having pain in your shoulder means you've got frozen shoulder. How do we differentiate between frozen shoulder and shoulder impingement? One very simple way that we can actually differentiate is range of motion. So patients with shoulder impingement normally gets pain in their shoulder, either a painful arc, which means a range of motion that is a little bit painful, and then once they get past that painful range, they actually have got full range. So that's normally a sign of shoulder impingement. Frozen shoulder is normally more mimicked in the sense that you have limited range of motion and you can't go any more than that. So that is really frozen shoulder. So is frozen shoulder and shoulder impingement the same? No, it's not. One is an inflammation of a tendon, whereas one is a tightening of the capsule. We can simply reduce the pain through a posterior capsule stretch by putting the elbow across the body, pulling outwards like cradling a baby, and getting a nice stretch at the back of the shoulder here. This might help to reduce a little bit of your pain in the shoulder when you're moving it. The next most important thing is watching your posture. Patients with shoulder impingement tends to have a very rounded shoulder, or what we call protracted shoulders. This actually decreases the subacromial space in the shoulder, and when you move your arm up, it pinches on the tendon, and that's where you get the pain. Also, we will always encourage our patients to actually open up the shoulders, squeeze the shoulder blades, make a small little V between the two shoulder blades, and try to maintain this posture. This has been found to be able to alleviate a little bit of discomfort when they're moving their shoulders.